I'm working in the ERASMUS Medical Center in Rotterdam, in the Department of Neurology, and we are focused on clinical proteomics and especially related to cancer, but also other topics like antimicrobial resistance. And I had a problem because I'm working in a hospital and this website was not allowed to enter, so I have to rush a little, and I hope I'm still understandable well. So thank you for invitation, for telling a little about our experience with EVOSEP and the devices what we use in the lab. We use it for detection of proteins coupled to an Orbitrap, and I will show you a little data from that. Hopefully I can go to the next slide now. Okay, great. So the whole idea of bacterial resistance detection, that is, this kind of resistance leads to significant morbidity and mortality worldwide. So it is a big issue. And the early detection and the fast detection of it have facilitated timely isolation and early appropriate therapy. And this will hopefully reduce morbidity, mortality, and also the length and cost of hospital stay, and can improve, can be an improvement for these patients. We go to the next slide. So our workflow is like using bacterial cultures, pre-treatment, digestion, spiking internal standards, and we use an LC-MS analysis and targeted approach to look at specific peptides. What are characteristic for an antibiotic resistance mechanism? We use a kind of data processing, and in the bottom it's a kind of cartoon how Orbitraps are working, and the right is in data analysis. We have an internal standard, synthetic synthesized peptide with stable isotopes, and we can define the quantity of a certain peptide by this approach. We use the EVOSEP One device, the tips for this, as also just described. We are linked to a few effective HF Orbitrap, and can we go to the next slide? And so we like to identify the mechanism of antibiotic resistance, but you can also use the mass spectrometer right away to detect what kind of bacteria are in this kind of cultures or blood cultures. Here is an example from quite a large number of strains of pneumonia, E.coli, and it rarely can be observed that this kind of organism by doing so can be discriminated, and you can also detect certain proteins which are related to resistance mechanisms in many occasions. That can be beta-lactamase, and that can be detected. Next slide, please. So, for instance, if you like to detect this antibiotic resistance mechanism, you need specific peptides. And can you click one further? Here is an example of a whole series of the genomes of bacteria with beta-lactamases, and then varieties strains, TAM and SHB are examples here. And you can, the bottom are a SHB and the upper part is the TAM variant. We're looking at peptides which are discriminating this variant. And that you can already see by naked eye that it is possible to do. You have also stretches what is almost all the same in this kind of variant, but it's clear that you can two peptides for each mechanism, and the next slide shows that. Yeah. So the workflow looks like as follows. You have bacterial cultures. We use blood cultures. We have a kind of workup to process the bacteria. We use kind of peptide for material. Then we get from protein via an enzymatic digest to peptides, and then we use the EVOSEP if loading and use the EVOSEP One for coupled to the Orbitrap. And then we have via Skyline software and kind of reporting compared to what is possible, what kind of medication can be used, and that we have developed together with a DaVinci company. It's on this line. It indicated what is fully automated, partially automated. We try to get it fully automated, that it's clear that the red one is the manual part. We try to optimize that to a automated way. I think the bottom line is already kind of partially automated to fully automated. I think together with EVOSEP we try to make this fully automated. Next step, the next slide, please. So here's the kind of protocol how we perform it. We use the positive blood cultures. We add a kind of a light buffer to it. We have to mix it, centrifuge it, and wash it. And we have to prepare it for the mass spectrometer. We use this kind of reduction step. We add a kind of reference material to stabilize it with labeled peptide, what we have chosen here is database. We sonicate our material, and then we add the setting time for trypsin and stop it, and then we can bring it to the EVOSEP tip. Next slide, please. Yeah. As already presented in the previous presentation, there is a by EVOSEP protocol. It's giving you the wash, the condition, the tips. You have to equilibrate, and then you can load, you can wash, and you have to wet, what is a clear-cut item that you have not to work in the tips which are dry and so to be wet, and then you can use it. And next step, next slide, please. And it's also mentioned in the EVOSEP website that the advantages of this kind of tips, and it's also mentioned in the previous presentation. But I think it's also of interest that if you have this parallel way of tips, that it also prevents that one sample will block the whole series. What can happen if you have a serial measure? Of course, it's also mentioned that carryover can be reduced by this kind of tip, and I think it's highly nice that we can use this kind of tips in the clinical for clinical applications. And I think the possibility to automate with this kind of tips is highly possible. Yeah, also presented in the previous presentation. Next slide, please. So just giving you an idea what is happening. If you have such a sample, and then we are talking about a sample time of 10 minutes or this kind of order, and you find with this DRM, it's targeted way of finding the peptide. You can have it, can find the peptide, what is in the upper panel, and in the lower panel we don't find anything. Only we can find the masses sometimes, but for sure nor the transition as are mentioned in the above. So in that way, you can also give a kind of quality value to this kind of measurement, and that can be done exactly using this highline of software. Next slide, please. Of course, these kind of samples can have different amounts of proteins, and so we use a kind of standard like a peptide, what is always present in this kind of sample, and then we have a kind of idea if enough protein is loaded. So you can see there are some holes in it. So this kind of samples would be excluded. So for this whole series, we found one more or less in the middle is one with a very low concentration, so that can be excluded. Next slide, please. Here an example for strains like KPC and FIM. We know the peptides which discriminate this kind of antibiotic resistance mechanisms, and you can nicely observe the ones which are positive and negative for this kind of strain. We use two peptides for one antibiotic resistance mechanism. So the lower one, you can see that the peptide starting with NTA is doing a little less than the VGG peptide, but combined it gives a very good feeling there what kind of antibiotic resistance mechanism we are dealing with. Next slide, please. And just another example for OXA and the M variants, and the lower one you can see that it shows that it must be present, but the sensitivity is much lower. But still the peptide FGD gives a good feeling there, this kind of antibiotic resistance mechanisms in which strain it was observed. And next slide, please. So here is a whole series of this kind of antibiotic resistance mechanism, and we compared it to the whole genome sequencing of this kind of bacteria, so we can make a kind of sensitivity, specificity assessment, and that looks almost perfect for this kind of measurement. We've also published it. I think this is a technique possible to make it very fast and to detect this kind of antibiotic resistance mechanism in a fast way. Next slide. And yes, this work is still ongoing. We have a collaboration with EVOSEP and Peptides in Rotterdam and Peptides, which is in Norway, on data analysis part. And we are supported by Eurostar projects to make this happen. It's a very good step that EVOSEP makes this automation, and that we can perform this in very fast processes. Antibiotic resistance mechanisms in sepsis patients that need very fast answers. So to speed up this kind of techniques is really to make it a good application. We think that it's possible by doing so. Thank you for your